Instrumentation. Instrument function: grasping and holding, locking clamp. Thumb forceps. Adson with teeth. Bony tissue forceps. Smooth or non-toothed. Smooth Adson forceps. DeBakey forceps. Biting clamp. Coker. Holding and manipulating, tenaculum, used on fibrous tissue, clamping and occluding, a traumatic clamp. Duval lung clamp. Babcock clamp. Occluding clamp. Kelly, Cryle. Vascular. Clamp. Bulldog. Satinsky. Pulley. Cutting and dissecting, scalpel. Beaver blades. Scissors. Castroviejo. Wronger. Stilla, Carrison, long-handed, often used in spinal surgery. Shears. Curette. Osteotome and chisel. Gouge. Elevator, rasp. Retracting Balfour. Bookwalter. Dilating and probing, dilators. Measuring, uterine sound. Depth gauges. Suturing, Heaney. Mayo Hagar. Suctioning, Yankauer. Vascular instruments: Cushing forceps, DeBakey forceps, Cooley vascular clamp, Potts-Smith scissors, right angle forceps, jeweler's forceps. Surgical tray setup: cardiothoracic tray, orthopedic tray, obstetric tray, thyroidectomy tray, genitourinary tray, cholecystectomy, laminectomy. There will be at least one question involving the previous mentioned. Catheters: Foley, retention catheter, has a balloon at the inserted end which prevents catheter from sliding back, usually used for long-term catheterization. Straight catheter, made of rubber and does not have a retention balloon. Straight catheters are used during a diagnostic procedure where urine needs to be eliminated before or during, or for the injection of medium during a cystography. Coud catheter: this can be a straight catheter or Foley. The Coud catheter has a firm or rubber. Fogarty catheter, used in simple embolectomy procedures. Gibbon catheter, used mainly for long-term drainage of the bladder. Tips: Fraser, used to remove small quantities of fluid which may have accumulated, often used during plastic or peripheral vascular surgery. Pool abdominal tip, used to remove ascites or irrigation fluid from the abdominal or chest cavity. Yankauer tip, used to remove fluid during intraoral, intra-abdominal, or intrathoracic surgery. Sutures: non-absorbable suture, a type of suture which is never absorbed by the tissue, but becomes encapsulated by it. Absorbable suture: any suture that is digested by body tissue. Non-synthetic suture: surgical gut, catgut, available in plain and chromosized. Plain non-synthetic surgical is used in tissue that will heal rapidly. Chromosized non-synthetic suture is used in tissue that will take longer to heal. Chromosized non-synthetic suture will resist absorption by body tissue. Surgical gut, non-synthetic suture, is commonly used in gynecological and genitourinary surgery. Synthetic absorbable suture is made from synthetic polymers, and has recently replaced catgut suture. Synthetic suture can be used in the presence of infections and in gastrointestinal surgery. Silk manufactured from degummed threads of silkworm larvae, silk sutures are used in eye tissue, gastrointestinal tissue, and blood vessel tissue. The use of silk suture is contraindicated in an infected surgical site and urinary tract procedures. Nylon sutures are manufactured from coal and are considered to be inert, non-reactive with tissue. Nylon sutures cause little or no inflammation at the surgical site. Nylon sutures cannot be sewed in an area where long-term approximation is important. Wire suture come in stainless steel and silver metals. Stainless steel is the most inert suture available. It kinks easily and has a sawing effect on tissue. Steel is used primarily in orthopedic surgery to approximate bone fragments or tendon repair. Silver sutures are used to close wounds that have undergone dehiscence, such as lacerations, or puncture wounds.